Now let us discuss the deep arteries of anterior abdominal wall. So anterior abdominal wall is mainly supplied by large arteries from above, like you can see the superior epigastric artery and also the musculophenic artery, so which are in turn coming from internal thoracic mammary artery. So this are the two arteries which are supplying the upper part of the anterior abdominal wall, and you also have the large two arteries from below, like inferior epigastric artery. So you can see here this is a inferior epigastric artery, and also you have the like deep circumflex iliac arteries. So the circumflex iliac arteries, so these are like supplying the lower part of the abdomen, and there are like small branches of intercostal and subcostal arteries. So you have like posterior intercostal arteries, small branches, and also you have them subcostal arteries, right, which are small branches which supply the lower part of abdomen. And also you have lumbar arteries which accompany corresponding nerves. So lumbar arteries also supply this lower part of abdomen. So first let us discuss about the superior epigastric artery. It is one of the two terminal branches of internal thoracic artery. It begins in the 6th intercostal space and enters the abdomen by passing behind 7th costal cartilage between the costal and scaphoid origins of diaphragm. So it enters the rectus sheath by crossing upper border of transverse abdominis. Within the sheath it turns vertically downward, supplies rectus muscle, ends by anastomosing with inferior epigastric artery. So you can see the anastomosis between superior epigastric artery and inferior epigastric artery, right? And in addition to muscular and cutaneous branches, it also gives hepatic branch. Okay, so it also gives one hepatic branch, and it hepatic branch runs in falciform ligament, and it anastomose and an anastomosic branch at the level of scaphoid process here, and it anastomose with the artery of opposite side. Next, coming to the musculophenic artery over here, right, it is other terminal branch of internal thoracic artery, and it runs downward laterally behind 7th costal cartilage. It enters the abdomen by piercing the diaphragm between 7th and 8th cartilage. Continue downward laterally along deep surface of diaphragm as far as 10th intercostal space. It gives branches to diaphragm, anterior abdominal wall, 7th, 8th, 9th intercostal spaces as anterior intercostal arteries, and the inferior epigastric artery arises from external iliac artery near its lower end, just above the inguinal ligament, right, and it runs upwards medially in the extraperitoneal connective tissue, as you can see here, and passes medial to deep inguinal ring, pierces the fascia transversalis, and at the lateral border of rectus abdominis, enters the rectus sheath by passing in front of arcuate line. So let me show the diagram for this. So here you can see it is passing above the arcuate line, so it is piercing the rectus sheath and entering into it. So this is an inferior epigastric artery. So within the sheath it supplies the rectus muscle end by anastomose with the superior epigastric artery, and it gives off branches like cremasteric branch to the spermatic cord, and also it gives a branch to spermatic cord or artery of round ligament in females, and also it gives a pubic branch which anastomose with pubic branch of obturator artery. Okay, and also it gives a muscular branch to rectus abdominis muscle and cutaneous branch of overlying skin. So pubic branch may replace obturator artery, then it is called abnormal obturator artery, right? So sometimes what they're saying, the pubic branch of obturator artery, it is replaced by obturator artery, then it is abnormal obturator artery. The deep circumflex iliac artery. Deep circumflex iliac artery, let me show for this and again this diagram. So you can see here the deep circumflex iliac artery. This is superficial, right? So like that you have a branch of deep circumflex iliac artery here. It is other branch of external iliac artery. It is given off from its lateral side opposite origin of inferior epigastric artery, runs laterally upwards behind inguinal ligament, pierces the fascia transversalis, continue along iliac crest up into the middle, it pierces transverse abdominis and to enter the interval between transversus and internal oblique muscle. At anterior superior iliac spine, anastomos with superior gluteal and lateral circumflex femoral and superficial circumflex iliac artery just behind anterior superior iliac spine. It gives off ascending branch which runs upwards in the neurovascular plane. So by this we have completed our deep arteries. You can also check out this diagram to understand this topic more clearly. Like you can see, this is the skin, this is the anterior wall of rectus sheet, and here you have the rectus abdominis muscle, and this is the costal cartilage. So this is a superior epigastric artery which is passing between the costal cartilage and diaphragmatic fascia, right? So from there it will pass and it will pierce the rectus abdominis. You can see after piercing it will come downward. It's like between the anterior wall of rectus sheet and the posterior wall of rectus sheet. So if you see the superior epigastric artery, it is piercing both posterior wall of rectus sheet and also rectus abdominis muscle, and it will come here. Why? To anastomose with inferior epigastric artery. Remember that the inferior epigastric artery will not pierce the posterior wall of rectus sheet. It will just pass below the posterior wall of rectus sheet, but it will pierce rectus abdominis. Okay, so this is an arcuate line. So just you can say below the arcuate line, the inferior epigastric artery will pierce the rectus abdominis, and they both will anastomose here, right? So this is just like a recalling of superior epigastric artery by means of this diagram. So by this we completed deep arteries of anterior abdominal wall.